Hello, my name is Dr. Charles Modlin. I am the first ever MetroHealth Medical Director of the Office of Inclusion, Diversity, and Equity, and I am also a practicing urologist. Some of my major responsibilities in the area of inclusion, diversity, and equity include working to promote, facilitate, and ensure that MetroHealth, as well as its graduate medical education program, assembles a diverse professional staff. The evidence is clear that having a diverse professional staff, which includes physicians and surgeons, advanced practice nurses, physician assistants, and postgraduate physicians, is central to improving health outcomes, especially in underserved populations and those most prone to experiencing health disparities, such as racial and ethnic minority populations. Diversity is not limited to racial or ethnic diversity, but also includes diversity in gender, sexual orientation, religion, age, and language, among others. It is not enough to simply recruit a more diverse professional staff to serve our patients. We must together work to be able to retain them, as well as provide opportunities for diverse members of our professional staff to advance within the organization. We must work together to ensure that while here at MetroHealth, their professional staff experience is optimal. These are objectives in which I will focus much of my efforts as Medical Director of the Office of Inclusion, Diversity, and Equity at MetroHealth. Another responsibility is for me to provide mentorship and teaching to high school students and college students to promote, encourage, and facilitate their interest and opportunities for them to enter the STEM professions. As Medical Director of Inclusion, Diversity, and Equity, I am focused on delivering department-specific, system-wide clinical initiatives, teaching health equity, as well as community outreach and health equity research component programming. Health disparity disease states exist in every area of clinical medicine. It is therefore important that every specialty area, inclusive of our internal and family medicine, pediatric medicine areas, focus their efforts on elimination of health disparities in those areas of medicine and surgery. I will be working in collaboration with MetroHealth's Institute for Hope, Population Health Innovation Institute, and Population Health Research Institute, so that together we can address the numerous and complex social determinants of health that are at the root causes of the many health disparities that we see disproportionately afflicting especially people in communities of color, as well as underserved communities. There are many social determinants of health, including poverty, living in food deserts, lack of quality schools, lack of transportation, living in unsafe and unhealthy environments, past and present history of discrimination and racism, and deficiencies in health literacy, language barriers, and other factors. One activity which I am devoting a considerable amount of time, along with my colleagues here at Metro, is in creating and establishing MetroHealth's first free annual Minority Men's Health Fair, which will be held on Thursday, April the 28th, between the hours of 5 and 8:30 p.m. in several simultaneous locations, including at MetroHealth's main campus, Cleveland Heights, and other to-be-determined MetroHealth locations. The health fair, which welcomes all people regardless of race, ethnicity, gender, or demographics, intentionally targets men of color, because men of color are the group most often afflicted by a plethora of health disparities and have the shortest life expectancy of any group in America. Some examples of health disparities include higher rates of hypertension, diabetes, heart disease, lung disease, kidney disease, and several types of cancers, including colorectal cancer and others. In the case of prostate cancer, which my urology colleagues and I treat, black men develop and die from prostate cancer at twice the rate of their white male counterparts. At the Minority Men's Health Fair, we will be performing free health screenings from head to toe. Every specialty area of medicine and surgery will be performing free physical examinations and screenings. MetroHealth and our community partners will be providing attendees with health education information and connecting people with important MetroHealth and community resources. So stay tuned for more information regarding the health fair, and please spread the word. Pre-registration will be available, but you may also register in person on the day of the health fair. In addition to practicing urology and performing surgery, these important initiatives are just some of the things that are keeping me very busy at MetroHealth. With that, I will close by saying that I am honored and appreciative to be part of the MetroHealth family. Thank you.